Jitendra to come over to the stage, and I would like to read introduce them. Dr. Koteshwar Rao. Dr. Koteshwar Rao was born in a farming family in Dendaluru in West Godavari, graduated from Kasturba Medical College, Manipal in 1966. He worked as a medical practitioner in UK from 1969 until his return back to India in 1988. During this period, Dr. Rao was involved in undertaking several clinical trials on various drugs. He was one of the first entrepreneurs in UK to enter and promote several medical and health-related projects such as nursing homes and private hospitals between 1979 and 87 in UK. Dr. Rao was appointed as tribunal member in 1985, a highly prestigious appointment by the Lord Privy Council for a period of 5 years by Lord Chancellor Honourable William Whitelaw to monitor the standards of all cared hospitals in UK. The tribunal was an apex body for the whole of UK. As a recognition of his skills in management, Dr. Rao was awarded honorary membership to the British Institute of Management in 1985. Dr. Rao is the chairman and managing director of Transgene Biotek Ltd, one of the first biotech companies in India listed on Bombay Stock Exchange in 1992. Under his management, Transgene filed several patents covering India, US and PCT countries on oral delivery of insulin and hepatitis B vaccine, novel vaccine technologies, and also the development of several cancer drugs using monoclonal antibodies and RNAi technologies. In his capacity as the managing director of Transgene Biotek, Dr. Rao holds several patents along with other scientists involved in all projects under development at the company. Dr. Rao is currently on the board of directors of NiedlFree Technologies Pvt Ltd. Thank you, sir. Let me also introduce CA Vishwanath Toshniwal. Vishwanath Toshniwal, born in Guntur, completed his CA at the age of 22 and worked as equity analyst with IDBI Bank Mumbai till 2011. He has been a mentor for various startups and has been virtual CFO for startups. He has vast experience in debt syndications and fundraising. He is certified business valuer. He is one of the promoters of NiedlFree Technologies, contributing for its finance, business strategy and compliances. And about Dr. Jitendra Ambulje. Dr. Jitendra Ambulje did his masters in nanobiotechnology, PhD, and has over 27 years of experience in research and development of biosimilars. He has worked with OCAD, Vitane International Biologics, and has several patents in his name nationally and internationally. Several research papers have also been published by him, along with 2 books published in biopharmaceuticals. He is the co-promoter of NiedlFree Technologies, looking after development of various biosimilars. Now I'll hand over the mic to the distinguished directors and request them to take it forward.
Thank you. Thank you. And thank you all for coming. And we really appreciate for you to come, especially during the election fever that has already gripped the state at the moment. And we really thank you for devoting some time to come here and to listen to us. The reason why we actually invited you to come is basically to witness a revolution that is started and is likely to affect the population in the entire world. Not just in India, not just for one disease, but diseases that cover most debilitating conditions such as Alzheimer's, Parkinson's, osteoporosis and cancers, and of course the diabetes also anyway, even though it's not debilitating, but still it affects the lives of the people. It is a transformation that is actually giving us immense satisfaction to announce to the world. Here we are, coming from India, and showing to the globe that we can innovate on par with the best of the world. Our demonstration of the result that has been conducted thanks to one CDMO company called a very renowned Palamur Biosciences. That's where the studies were conducted to demonstrate the efficacy of this oral insulin as one of the first products that are going to come out of NiedlFree. Why we are mentioning about oral insulin is I'm sure you must have heard there are several companies, dozens of companies that have been trying to deliver insulin by mouth. Not now, probably for the last 1.5 decades. We are also part of that. The innovation in developing any product is like snakes and ladders. You think you have climbed up to the top, only to realize the big snake has bitten, and then you fall all the way down and restart all over again. That's exactly what has happened to us also. We started this exercise way back in 2001. Now it is 2023 when we got the success. So you can understand how difficult sometimes the success of any innovation is likely to be. Today we will show you in the slides how and what has been done and what are the results that we are trying to display to the world, why we are so jubilant to announce to the world. So it's not really pleased. So the basic fundamentals of this particular innovation is the three words: comfort, convenience, and compliance. I'm sure many of you know any drug should be comfortable enough to take. So in terms of removing the injectable route and delivering by oral route or nasal route, you are actually creating a comfort, a zone of comfort. That's what we have done. Then the convenience, of course, it's convenient when you want to take a drug by simple oral route or as a spray into the blood. And then compliance. See, when you are giving injections or you have to admit it to hospitals, many times you fear and you will miss the dose. So what we are trying to do, or what we try to do by giving this particular technology a life, is to see that the patient do not miss their dosage, so that they can become drug dosage compliant. So they cannot miss any dose and they can take the drugs. The challenges that we have faced and the solution that we have provided is, first of all, identify the problems. Let us say discomfort, of course, I just now said, by giving it as a nasal route, as a simple spray. I think some of the devices are here for you to see. A kind of spray into the mouth, back of the mouth. I'll tell you in a minute as we go forward, and then avoid the recycling of the materials, of the dozens and dozens, millions of injections. Plastic syringes, etc. Can you please go? This is for those who actually have got some interest in the science, would understand how the innovation has taken place. The entire technology is based on, many of you must have heard about nanoparticles, which is a very common item nowadays. It is not just the design of the nanoparticles that is formed the basis of our technology. A word that we have introduced to the world, functionalization of the nanoparticles. Not just the creation of nanoparticles itself, that itself is a challenge, especially using the polymers. Many of you must have heard in the recent past from the COVID infection, like BioNTech or Moderna using nanoparticles. There they use lipid nanoparticles. Here we are using biopolymers, completely different thing. They were using nanoparticles, we are using also nanoparticles, but the materials are completely different. Where we have scored over many others is hybridization of the polymers and lipids. Obviously we got the patents across the globe, covering almost every single country in the world. And the double encapsulation, when you are delivering by mouth, there are so many challenges. Those who of us have been familiar with the science would know there are so many challenges giving by mouth. Whether it is solubility issues, or whether it is pH changes, or whether it is enzymatic changes, or even the movement of the gut itself, peristaltic movement, what we call, or the absorption into the systemic circulation. So in order to overcome all those challenges, we had to really do the double encapsulation, and those yellow bits on the surface of the particles are the particles of functionalization of the nanoparticles, which is a new terminology we have introduced into the drug world, as you will hear in the future to come. Next, please. So these are the devices. The one with the long arm at the top is the spray that you can just give it in the mouth. Instead of giving the injection, you just spray it in the mouth, back of just in the mouth. Whereas the one in the below that is something that is going to be held in the future, not just for only direct systemic circulation, like we can give the insulin also if you want by nasal spray. But for me as a doctor, which has, especially at my age, one thing that is I'm looking forward to, probably I'll come back to in the next few months, is a drug that could be delivered into the brain. They you are not displayed. They're completely different thing. One is for systemic circulation and one into the brain, which is the most challenging, especially for conditions like Alzheimer's or for brain cancers, where the drug cannot penetrate enough. That will come back in the future. Next please. Now, coming to what are the areas of our focus in the drug industry for our technology. Our current focus, as you notice, are not the vaccines. Even though we can do it, but there are so many competitors which there's no point in keep on competing with everybody. So we have chosen, one is diabetes, as you see today, oral insulin. Osteoporosis, where people keep on, elderly people, bone calcium being deprived, and they break the bones and have the spinal problems, long leg problems, like osteoporosis, where they have to take injections every month, where we can do it simple nasal spray. The other one is Alzheimer's, Parkinson's, brain tumors, and then oncology. This is the area I've really been focusing. I hope to come back to in the next 6 months or so, because we are already talking to one of the biggest European companies for the what we call it monoclonal antibody drugs, cancer drugs. For administration of these cancer drugs, there is no other route other than by injections, especially monoclonal antibody drugs. Because let me not bore you with all the scientific terminologies, but they are big molecules which cannot be given anything else but than injection until now. What we have done is a breakthrough of that also. We already tried on particular monoclonal antibody drug, and based on that, we are already in the active dialogue with this European company for delivering their monoclonal antibody drugs by simple oral route like this one. Instead of hospital admission, so you avoid hospital admissions, avoid the cost of hospital admissions, you avoid the pain of the hospital admissions, and putting up a drip and the intravenous route. All that you will avoid with a simple spray. So you become more drug compliant for cancer patients, which is extremely important. Next. Well, we have the current infrastructure, obviously, without all that, we'll not be able to do. Please carry on next. And you see the diabetic market, which we are focusing, is what?
52 billion.
52 billion. Well, it's not something like what? 68 crores plus 24, I know what was it? Big numbers. So it's a diabetic world. And now let us see exactly what this jubilation is all about today. This is about, we have done immense number of studies already in the diabetic rats, small animals of different kinds. Over the last 10, 15, 20 years, we've been doing studies and studies after studies. And we have done canine studies also earlier. But in order to reconfirm our enthusiasm, we've done the studies again at the Palamur Bioscience, as I said. It's a renowned biopharmaceutical company, CDMO company, and on the dogs. The significance of this particular study, forgive me if I am teaching a little bit of science about diabetes, just for a minute. Why it is so important? In the normal healthy dogs, whenever there is glucose, rise of glucose in the blood, immediately it releases insulin to counter it. Along with the insulin, before that, there is a peptide called C-peptide is also released into the blood. I will not go into scientific details of how the C-peptide is produced by the blood and its connection with the insulin. Every time there is levels of glucose increases, C-peptide levels also come up. Please remember that very important point, especially normal healthy people. Whereas in diabetic population, type 1 diabetes, the C-peptide levels will not be there, and your insulin also will not be there sufficient enough. That's why you have developed diabetes type 1. In type 2 diabetes, there may be some, but insulin levels are less, relatively less. So we have chosen 4 non-diabetic healthy dogs. In those diabetic dogs, we have first of all to ascertain if any of those dogs are, if we miss in case they are diabetic or not. So we measure by starving them overnight, then give the glucose drink and measure the insulin levels and C-peptide levels. If it is normal healthy dog, C-peptide levels will come up along with insulin levels also. After giving the glucose, that's what we did in the first left one. There is a rise of C-peptide as well as insulin level. In the second one, after it, the same thing is repeated after 4 days of gap. Then we done the subcutaneous injection, then followed 3 days gap, and then nasal, and then oral. In all these levels will come. Next please, next, I'll come back. See, in these things, what you see, the C-peptide levels in a normal healthy dog, before we give any external insulin, before we give our oral insulin, C-peptide levels are 4.95 nanograms. Whereas, when you give any insulin from outside, as it is subcutaneous form, oral insulin form, or nasal insulin, the levels are much less because they are competing with, they are suppressing the nasal producing insulin. So the nasal insulin producing will be suppressed and the all same peptide levels also will automatically come down along with it. Now go back one. And now looking at the glucose levels, next one, glucose and insulin levels. Look at the subcutaneous, the whole study is how